Hello, how are you?
Good. How are you?
I'm doing great. So good to see you again.
It's nice to see you too. Happy Thursday.
Yes, I like to say happy Friday.
Ah, yes. Happy almost
Or
Friday.
Friday Eve. Sorry, Friday
Yeah.
Eve. Almost there. I can't wait. Can you tell?
No, I feel the same way. I'm just like almost TGIF or TG. Thank God it's almost
We're so
TGIAF. There you
close.
go.
We're so close. Almost there.
Yeah.
Um, okay, really quick before we jump in and start today's segment, let me just say that the information provided on today's live is for educational purposes only. It does not substitute for personal medical advice. We advise users to consult a local medical professional or healthcare provider if you are seeking medical advice, diagnoses, or treatment. Okay, with that being said, hello everyone. Welcome to today's segment of Derm Talk. We are so happy to have you here. I know it's been a minute since our last live, but we're back. And I'm so happy to be back with you guys today. My name is Linda, and I am going to be your host for today's segment. I love doing these. I always have so much fun. I learn so much information, and it's such an honor to be able to host these. So I'm really, really happy to be here with you guys today. For those of you who haven't ever joined us for one of these segments, what they are is we sit down with a dermatologist, like our wonderful Dr. Nkem here with us today. We sit down with a dermatologist from our Dermatology Advisory Board, and we talk about all things skin. Skin types, skincare concerns, products, tools, absolutely anything that has to do with the skin, we cover here on these segments. So it's a lot to cover. We always have a lot of fun, and we learn a lot. So thank you guys for being here. It's going to be a good one today. Also, speaking of skincare questions, any of you that come up with a question today during our live, please be sure to drop your questions down in the comments. We will make sure that we get to all of them. If we don't answer them today in the live, we will absolutely still get back to you after the live, either a comment or a message or something like that. We will get your questions answered. So please be sure to drop those questions down in the comments so that we can get them answered for you. Okay, so today's guest, as we said, is no stranger to these lives. She has been here before. It is Dr. Nkem Ugonabo. She is an MD, MPH board certified and fellowship trained cosmetic dermatologist at Union Derm located in New York City. Welcome back. Again, it's so great to have you here with us again. Thanks for coming by.
Thank you for having me back.
Yeah, absolutely. I'm actually really excited for today's segment because the topic that we're going to be covering today literally applies to every single person out there. It's not just like, one certain skin type, this is going to apply to you. This is for everyone. We are talking about aging skin. We all age. We all are dealing with the changes in our skin as we age. So, Dr. Nkem, if you can kind of talk to us today about what happens to our skin as we age and what are some things that we can do to try to keep up with it.
Right. So as you said, aging happens to everybody. I even tried personally not to call it anti-aging anymore because it's an inevitable process. It's a beautiful process and something that we should embrace. My mom always says, "What's the alternative?"
Yeah, so, we're all aging. Let's do it exactly. Together.
Exactly. So it's more like graceful aging, so to speak. But what happens is, the biggest thing that leads to the changes associated with aging is the loss of collagen, which starts to happen as early as your 20s, believe it or not, and accelerates as you get older. And collagen is one of the things in the skin that gives it that firmness, that plumpness. You also get a little bit of loss of something called elastin, which gives it the elasticity. And so over time, you may start to notice that your skin is not as supple or as firm as it used to be, and may require a little bit of extra TLC to get it to look like it did before.
Yeah, absolutely. So I know myself personally, I've noticed probably the biggest change in my skin in the last few years, especially once I hit my 40s. It's like everything changed. And I had to kind of relearn how to take care of my skin because I couldn't do the same things that I did back when I was in my 20s anymore because my skin had changed. So in addition to like the loss of, collagen and things like that, the breakdown of it, I should say, as you get older, what are some other things that kind of cause that? Like obviously there's a huge difference in our 20s. Your skin is more vibrant. and bright and youthful, and it seems more, you know, hydrated, and it just looks so much better. And then as you get older, it's almost like, you know, you start to maybe get a little bit more of that sullen look, which I know is the breakdown of collagen. For a lot of people like myself, my skin got very, very dry, whereas I never used to experience dryness before. So are there other things other than just the breakdown of collagen that kind of changes our skin?
Yeah, there are external factors that can accelerate aging. And the number one is, which is funny because I feel like I knew we were going to talk about sunscreen and sun-related stuff, but we made it all of 5 minutes before
I know. It's so important.
But it's
like
always relevant, you know. Exactly. UV radiation in the form of, you know, sunlight and unprotected sunlight, I should say, is one of the things that does accelerate the aging process. And, you know, it's been studied, it's been documented. So it's not a hypothesis, it's a fact. It does accelerate aging, which is one of the reasons why we encourage sunscreen, in addition to all the other benefits of sunscreen, of course. There are also, you know, free radicals in the environment. Like if you live in a place where there's a lot of pollution or environmental damage, that can accelerate aging as well. And then there are other things that are more like personal habits. So for example, smoking, unhealthy eating, those are the more internal things that can accelerate aging too. So there's a little bit of a balance of internal and external, where everyone ages overall, but sometimes there are things that you do or things that you don't necessarily protect yourself against that can make that aging process faster.
So even things that you're not necessarily doing to your skin, but that are still having an effect on your skin, like diet, you know, things like that. Okay.
Exactly. Yeah.
So obviously when we're younger, we don't have the same, I don't know if you want to call them problems, but, you know, the aging issues, let's say the wrinkles or the, you know, the color spots, the dark spots on your skin that you might have as you get older. But what are things that you can do, even if you're younger, let's say in your 20s or your 30s, and you don't, you know, you haven't experienced all of those things yet? Are there things that you can do to start then that can kind of help you as you go?
Yeah, so the first and foremost is, you know, try to be healthy and eat a healthy diet, have a healthy lifestyle as much as you can. As a dermatologist, of course, I'm going to go about sunscreen, which I think is
100%.
Exactly. You're never too early to start either. So, you know, it's not necessarily something that you have to do with when you have more mature skin, but even my kids, my teenagers, my 20-somethings, my 30-somethings, everybody, I say, you know, just protect your skin with sunscreen, especially if you're going to be outside, but even if you're going to be inside, because little known fact, sun rays can actually penetrate through windows. But yes, wearing sunscreen is one of the best things that you can do even at a young age to help protect against accelerated aging.
Yeah, absolutely. What about then for people almost who are on the other side of the spectrum now? They're on the older side and they haven't really taken care of their skin necessarily, or maybe they have, but just, you know, maybe not with all the treatment products or just kind of the basics, you know, washing, let's say. And so now they already have the dark spots. They already have the wrinkles. They already have, you know, the loss of collagen and the, you know, the saggy skin. Is it too late at that point, or what can you do even at that age to try to help maintain, you know, healthy skin?
Yeah, it's never too late, first of all, to answer that part of your question. I would say, I would try to incorporate ingredients that have been scientifically proven to help, you know, induce collagen, to help promote collagen, and which can be beneficial to help make the skin a little bit more, you know, supple and robust. And one of those ingredients is retinoids or retinols, which is just another variation of the same product. It's a derivative of vitamin A that we love as dermatologists and we prescribe, and it has a multitude of benefits. But specifically for the topic of this discussion, it also does help with anti-aging benefits. So retinoids have been shown at the microscopic level to help induce collagen, which means that it helps undo some of that process that we were talking about earlier where you lose collagen over time. And so even in a more mature patient who hasn't really done much in their younger years but want to know what they can do now outside of sunscreen, probably the first thing that I would say is consider starting a retinoid or an over-the-counter retinol, which would have similar benefits.
Gotcha. Like our retinol right here.
Yeah.
This little baby. My favorite. I love this. It works so good. And when you put it on, it feels so silky and velvety on your skin. It really is amazing. But I do just want to note real quick, since we're talking about retinol, One very, very important thing is if you haven't used retinol before, please make a note to start slow. It is a strong ingredient and a strong product, so you definitely want to start slow, 1 to 2 times a week, and then as your skin gets used to it and builds up tolerance, then you can incorporate it more frequently. But just wanted to throw that out there.
No, that's really important. Yeah, and if you have sensitive skin, consider using a moisturizer afterwards too, because they can sometimes cause irritation at first, and I would hate for someone to start and then stop because their skin got too irritated. So you can help mitigate that by using a moisturizer after your retinol.
Yes, absolutely. Very good. Very, very good. Speaking of retinol, since we're there, I'm going to kind of transition a little bit. I still want to, keep the age topic in our conversation, but I also want to pull in some questions that we have been asked from our Facebook group that they've put in there. So since we were talking about retinol, I figured I would kind of jump to some of those. One of them was, and again, this does have to do with age, so it's perfect. What is the youngest age that you would recommend for someone to start a retinoid or retinol product?
So that's an interesting question because it depends on the reason they want to start the retinoid or retinol. And I say that because if it's specifically for anti-aging benefits, I would probably start to think about that like somewhere in your 20s, if that was something that you wanted to proactively, use. But retinols and retinoids also have anti-acne benefits. So I actually have, I would say probably the majority of my teenage acne patients are on some form of a retinol or retinoid. So I would put it on someone young for the acne benefits. I wouldn't necessarily be, thinking about the anti-aging in a 13 or 14-year-old who is on a retinoid. But if you wanted to do it more so to be proactive with the anti-aging, I would say, somewhere in your 20s is a great time to start.
That was going to be actually my next question, was about the acne, because since it is known to kind of help with and have those benefits, like to help with acne, we've had people ask us before, like, my 13-year-old is, having breakouts, with the retinol work for them? And it's kind of one of those questions where, you don't know exactly where that line is of, how young is too young, when it's going to have those kind of benefits and whatnot. Okay, now, again, speaking to the acne question in retinol or retinoids, should someone with active irritated acne still use like retinoids or retinol or any type of acne products, really, if it's like an open irritated kind of acne?
So, irritated is like a word that can mean different things. But in general, if you do have, active, angry acne, you can still use a retinoid. But I would probably, again, emphasize the use of other ingredients to kind of help prevent further irritation, because you want to get the anti-acne benefits from the retinoid without causing more irritation, right? So you might want to consider a retinol that is a very gentle formula. You may also want to consider using it, once every other day or every 2 or 3 days, etc. And then lastly, you would want to be extra heavy-handed with the moisturizer. So I would use it in someone with active irritated acne, but I would just be a little bit more careful and probably a little bit more thoughtful in terms of how they use it. And I would probably use other ingredients as well.
Okay. One other issue that I know comes up a lot of times with aging is pores. And your pores start to, appear enlarged, and you're like, where did these come from? I never saw these before. So when it comes to pores, what ingredients would you recommend to help kind of clear out those pores, to help reduce the appearance of those pores as we see them popping up? What causes them as well? Also, if you can kind of explain that.
Yeah, so everybody has pores. I feel like one of the things that came out of the pandemic was this like hyperfixation on on pores, and people come in and they're like, oh, I need to get rid of my pores, and I was like, okay, that's not possible. We all have pores, and part of it I think is also social media, which I love and I think is more good than bad. But one of the things is you see a lot of close-up pictures of celebrities and things that people that you follow, and it seems that they don't have pores, whether or not that's like makeup or Photoshop. I don't know what it is, but let me tell you, your favorite celebrity has pores. That being said, some people do have more visible pores or more, enlarged or obvious pores that bother them. And that's, that's a very legitimate concern. And so one of the things that you can actually do to help with that, believe it or not, is the retinoid or retinol. It does help minimize the appearance of pores over time. So it's another great benefit or another reason why you would want to use it. In addition to other ingredients such as like salicylic acid can be helpful for that too. And then of course there are, different kind of like laser procedures and chemical peels, which we won't talk about too much in this live, but there are in-office procedures that can be helpful to minimize the appearance of pores, but they won't get rid of it. And they shouldn't get rid of it.
That's very important for people to know, is that, you might be trying a product or using a product that can help reduce the appearance of them. That's one thing, but they are never going to go away. They're normal. Everyone has them. They'll still be there, but yeah, we're just gonna maybe reduce the appearance of them a little bit. Retinol seems to be our star product today.
I know.
With aging,
I think they're great.
Star ingredient. That's good. Okay, let's see. There was another one. It's getting maybe a little bit away from the age topic, but it's one that we see quite a bit. So I still wanted to ask you, what type of ingredients do you recommend for someone with eczema? And are there certain ingredients that they should avoid?
Yeah. So eczema, patients with eczema tend to have very dry and sensitive skin. And so I always counsel those patients that when they're looking at buying different skincare products, they want to make sure that they're going to be gentle, which means you want to look for things that are fragrance-free, dye-free, those kind of things. Because when you start to have, fragrance and dyes, even though the product smells lovely and might look beautiful, if you have eczema or sensitive skin, it's going to be more likely to irritate that and possibly flare your eczema. So those kind of patients, I would say, in particular, you want to be a little bit more careful when you're picking a product. And in addition, if you do pick a product and you have eczema or super, super dry, sensitive skin, just do a test spot. Before you put it all over your face, whether you want to do a test spot on your hand or you want to do just a little one spot on your face before you put it over the rest of your face. I know there's a tendency to want to jump in and, start right away, but I think you're better off in the long run, because if you do react to something, at least you're going to react in one tiny little square versus your entire face.
Absolutely. Yeah, that's very, very important. If it's, especially like you said, if you have sensitive skin and it's a product you've never tried before, it's your best and safest bet is to just do a little test run to make sure your skin's going to agree with it.
Yeah,
you don't want to flare up everywhere. Okay, taking it back again to where we were before, talking about, not just for enlarged pores, but for anything. Back to the retinol. Like we said, it's a very strong product, but then we also talked about other ingredients that you can use, let's say for enlarged pores, like let's say salicylic acid or benzoyl peroxide, which is one for acne, things like that. Those are all very, very strong products and ingredients. Are those ingredients that you can all use at the same time? Do you need to kind of stagger them? How would you recommend people going about multiple ingredients that have the kind of strength that they do?
Yeah, so I would consider those ingredients, salicylic acid, retinol, benzoyl peroxide, even vitamin C. To me, those are active ingredients, meaning that they are actively doing something to your skin. And my philosophy is to start with one active at a time. So if you are someone who has a pretty clean slate with respect to your skincare regimen and you want to start something and you're looking at all these products, you go to Sephora and all these things are calling out to you, resist the temptation to do too much too soon. So if you have acne, for example, I would choose either a benzoyl peroxide or a salicylic acid. I personally would not recommend using both at the same time because individually they can be irritating, and so in combination it's more likely to irritate you even more. You can use sal acid and a retinol. So for example, sal acid in the morning and then a retinol at night. But if you're starting a regimen, I wouldn't start both. I would start with the retinol at night, for example, see how it goes over next 2 or 3 weeks, and then consider adding in the salicylic acid in the morning, depending on what you are using it for. But in general, slow and steady wins the race, because when it comes to your skin and your skin barrier, you don't want it to be overwhelmed by products, especially if it's not used to it. And everybody has to take some time to get used to a certain active. And so one at a time when it comes to active ingredients.
Yeah, and it takes your skin time to adjust to a new product as well. So just giving your skin that time to get adjusted is very, very important, especially if you want to add multiple products one at a time. Give each one your skin time to adjust.
Exactly. Especially if you have sensitive skin.
Yes. Oh my goodness. Especially, yes.
Yeah.
Okay. Another question that came in is someone said, I developed freckles on my upper lip during pregnancy and it's getting darker. Is there anything that you would recommend for that?
So without knowing what you look like.
I know it's always hard if you can't see the, see the person.
It could be a variety of things, but the pregnancy context makes me think that it might be something called melasma. And I apologize for the noise in the background. I live in New York City, so it's just it's part
city
of
life. It's city life.
It comes with the territory. But yeah, some women have a tendency to develop something called melasma, which is a type of hyperpigmentation. It tends to favor sometimes the cheeks and unfortunately sometimes the upper lip as well, which can be really frustrating, especially when someone doesn't know what you have and they think it might be a mustache or something. That's why I know it's really annoying for my patients, and we treat a lot of it. So I can't diagnose you, to whoever put that question in, but I suspect if it popped up during pregnancy and it's kind of this like brown spots there, it might be melasma. But I would see a dermatologist to confirm that diagnosis.
Yeah, absolutely.
Yeah, but if it is melasma, one of the main treatment I would say is obviously to wear sunscreen to prevent it from getting worse. And then there are a number of ingredients that we use to help with hyperpigmentation, which are applicable to melasma as well.
Great. Also, kind of speaking about, brown spots and dark spots, sunspots, whatever it is you want to call them. Why is it that it seems that as we get older, our skin is more prone to those?
That's a great question too. I think part of it is the cumulative effect of UV exposure or sun exposure over time.
Okay.
A lot of these conditions that are in the hyperpigmentation field are related to the sun, and not just UVA rays, but also even visible light. And so as we get older, we start to have an accumulation of that over time, and you may start to see a lot of those type of conditions. In addition, there are some that can be hormonally related. So for example, one of the reasons that women develop melasma during pregnancy, the thought is that there might be a hormonal component to it as well. So there are a number of factors, but it's not uncommon to see more of those like brown spots or hyperpigmentation as you get older.
Yeah, I definitely noticed as my hormones changed once I hit my 40s, especially that's when I started seeing mine pop up a lot. And so I was like, okay, what's going on? It was kind of the first like real trigger, that and then the dryness. But okay, there was another question here as well. What do you recommend to reduce facial redness?
That honestly depends on what is causing the redness. I will say there's something called rosacea, which is one of the more common reasons that people get redness. It is, I should say, it's a chronic condition, so there's no cure, but there are several ways that we treat it. There's a few topical options that are available via prescription from your friendly dermatologist. Sunscreen is also helpful. There's a number of lasers that we use to treat it. One is called V-beam laser, and that targets the vessels specifically in the skin that causes the redness. It's not a one and done, but it is very, very effective and can be done very safely. And then there are also things like chemical peels. There's even oral medications that we may prescribe. So first things first, get evaluated to see why you might be red. But one of the most common reasons is rosacea, and if it were in fact rosacea, those are the treatment options that we would discuss with you.
Okay, we have just a couple more that I want to get to. The last one I'm saving is I think a very, very popular question we get a lot. So and it ties into sunscreen. But before I get to that, kind of going back to the hyperpigmentation, dark spots, kojic acid is a super popular ingredient right now. Can you kind of explain to us exactly kind of what kojic acid does and how it helps with dark spots?
Yeah, so it, without sounding too like nerdy, like in the chemistry class, there's a process that leads to hyperpigmentation at the cellular level,
Mhm.
and kojic acid helps block that process. I think that's the nice simple way to put it. But it's great. It's available, in a topical form, and I actually really like kojic acid, especially because there's a lot of ingredients that we use that are only available via prescription, but kojic acid is one of the ones that I think is pretty readily available over the counter too.
Yeah, that's what we use in our hydrofader.
Yeah. So it's nice that it has a greater accessibility, I would say, to patients, especially those that are not able to get into a dermatologist's office. I wouldn't necessarily use it in isolation if you have, a significant hyperpigmentation, but it can be really helpful as one of probably a few products that would be helpful in that particular case.
Okay, great. Thank you. Okay, so to this sunscreen question, we get this one specifically about our sunscreens all the time. So I'm going to kind of show a little bit, and while I show how they go on, if you can kind of explain what the difference is between a chemical sunscreen and a mineral sunscreen or a hybrid. For instance, I have here our universal tinted moisturizer, and then I have our physical universal tinted moisturizer. And people ask us all the time, what's the difference? How does it go on different? One's kind of a hybrid between the two, and one is just mineral. So if you could kind of explain, the difference between the two, and really quick before you do that, I'll just kind of show what they look like, and I'll rub it in as you're speaking, and then we can kind of go. This one right here is the universal. It looks like this. As you can see, it's got that universal tint, but as soon as I start to rub it in, you'll see that it blends in seamlessly with skin. And then this one is going to be the physical. So they look very, very similar. The physical, I will say, is a little bit thicker than the universal, but as I rub it in, you can see that it blends in and it absorbs seamlessly into your skin, just like this. And then the physical is a little bit thicker coverage, just a little bit, but it will blend in as well, as you'll see as I rub. But yeah, if you can explain kind of what the difference between the two sunscreens are, physical and mineral.
That's a very popular question. The difference comes down to the active ingredients. So chemical sunscreens have active ingredients in it that absorb the UV rays and convert it to heat. So those are going to be your avabenzones, oxybenzones, etc. A lot of words that start with A and O. Right. Notice, because they are chemicals that are absorbing the UV radiation, they tend to blend in easier. In contrast, you have physical, sometimes called mineral, that's the same thing, sunscreens. That active ingredient is either zinc oxide or titanium oxide or some combination of the two. And they work to leave a physical barrier on the skin that's going to physically block the UV rays from going into your skin. So you have the chemical, which is absorbing it and converting it to heat so that it doesn't get absorbed. And then you have the physical, which is giving a blockade for the UV radiation. So because that physical sunscreen is blocking it, it tends to be sometimes more difficult to blend in, right? And so traditionally, back in the day, that's why you would see people using the zinc oxide sunscreens, and they'd have the really white, pasty look of zinc oxide. Fortunately, they have come a long way, and there are some physical sunscreens out there that do blend in. But exactly.
Blend it in so well. It doesn't leave that white cast at all. So this is a beautiful, beautiful sunscreen. I love this one so much.
And people always ask, which one is better, the chemical or the physical? Right. And there is no right answer. I say you go for the sunscreen that you're actually going to use. And if you're favorite sunscreen that blends in beautifully, that makes you happy, that's going to motivate you to actually put it on every single morning is a chemical sunscreen, go for it. Doesn't matter.
The one you wear is the best one.
Exactly. The only caveat to that I would say is, if you are someone with super, super, super sensitive skin, you may want to go with a physical sunscreen, just because sometimes those chemical absorbers that I mentioned can feel a little bit irritating depending on how sensitive your skin is. But other than that, wear the sunscreen that you like.
Right, absolutely. Yeah, so just to kind of show it one more time, I had put the universal tint here, and you can see, it's not even greasy and oily. It absorbed really, really well. Same with the physical that I put right here on this hand. I will say for people who are wondering about the two, the universal tint, the SPF 46 universal tint, this one is definitely going to be lighter. It's very sheer. It will leave your skin just with a very sheer glow. Again, going back to the physical, because it has those physical blockers, it was a little bit thicker. You do have to rub it in a little bit more, but it still blends in really, really nicely with your skin. So if you're looking for just like a super natural sheer coverage, universal is definitely the way to go. If you want just a little bit thicker, then the physical is probably going to be the best bet for you. I love them both, but for the days that I don't want to wear foundation, like today, I'm not wearing any foundation. I'm only wearing the physical tint with a little bit of like a sheer setting powder on my face, and that's it. So I love this stuff. This is kind of my go-to. But yeah, that was a big one. So I definitely wanted to get to that one today. And thank you for explaining the difference between the chemical and mineral and how they act differently. And yeah, that was great. Thank you so much.
No problem. No problem. It's not intuitive. So I have no issues explaining it. I do it all the time in my clinic because I don't think it's very obvious, you know, what the differences are.
Right. And again, I mean, sunscreen, number one, when it comes to aging skin, it's never too early to start. It's going to be your best bet, and your best product to start using is your sunscreen every single day.
Right.
So Dr. Nkem, thank you so much for being here with us again today. It was so great to see you and to have you back. I know it's been a minute, but we had a great time. I had so much fun. Thank you for joining us today.
Thank you for having me, and thanks everybody for joining, and thanks for the great questions too.
Yes, absolutely. For anyone, if I missed your question for some reason, we will still, like I said, we will get to all of them, I promise. But please, yeah, send in your questions. Even if you think of them later, hit us up on our Facebook community group or even here on Instagram, and we will get to all of them. So thank you all so much for joining us. It was great to be here with you guys today, and we will see you at our next episode of Derm Talk.
Bye. Happy Friday in advance.
Yes.